CDC's new tool to prevent infant hospitalizations. Sure, everybody's probably seen this one in the news already. I talked about it earlier in the week on one of my streams, but the new RSV vaccine. So now the CDC has officially approved the push. What does that mean for you? What does that mean for everybody, guys? Well, since the CDC went ahead and, approved it, FDA had approved it, but it goes through everybody else's approval, right? The AAFP, everybody gives their own recommendations. But now the CDC has approved Nirsevimab, that's the generic, to be used for RSV in children. So you guys are going to see a lot of the push for RSV and the vaccine, what the new immunization data is going to look like, guys. So now that the CDC has officially endorsed the RSV vaccine for children, you're going to hear a lot about it. So again, it's going to be very much that marketed and pushed, and in all the good reason too. And I'm not saying that in a bad way, right? Estimated 58,000 to 80,000 children under 5 years of age, most of them infants, are hospitalized each year nationwide due to RSV infection, with some requiring oxygen, IV fluids, or mechanical ventilation. Each year, an estimated 100 to 300 children younger than 5 die due to RSV. So, hopefully we can do some damage at preventing that trifecta piece there for the fall. Winter is coming, everybody. COVID, RSV, and flu are things you don't want to triple stack. So we are wanting to make sure we approve that. The RSV vaccine for adults 60 and older was approved in May. But now the CDC has approved the RSV vaccine for children. So this is going to get rolled out pretty soon. Probably within that September season, we'll see what the availability for the drug Beyfortus, or one of the brand name medications for it, is. So it'll be an intramuscular shot. It's going to be added to the infant vaccine schedule. Last year was a terribly bad RSV season. Not sure if everybody knew that or not. In the pharmacy world, we see and get a lot of different questions and a lot of different things going on with that. However, maybe the general public doesn't see it the same. So, the preventative shot for sure. I think most people have their opinions on vaccines as to what that would be, but, as a healthcare provider, I do advise a strong recommendation on the RSV vaccine, right, for infants and for adults over 60. So it's going to be hopefully, rolled out as soon as September, October this fall, and actually be in a really good position timing-wise to have some perhaps critical intervention. So again, in clinical trials with the injection, it cut a risk that that a baby would need to be hospitalized due to RSV by about 75%. Pretty impressive, right? So, again, we were saying got hundreds of thousands, like tens of thousands of hospitalizations for RSV that can be trimmed by 75%. And those hospitalizations are during times, cold and flu season, where hospitals are already getting, more bed increases and everything like that. But on top of that, COVID over the last, few years, an anomaly is obviously flooded the hospitals. So again, infant parents, talk to your pediatricians about the vaccine. It's not going to be rolled out yet, but you will find out, soon when it's pushed. And I'm sure you're going to see about it in the news. You're going to see about it in the media, and, the new RSV vaccine. So again, just to give you guys the information about the new RSV vaccine, brand name called Beyfortus. generic, most people don't think about the generic names for vaccines. Nursivimab. So that's, the RSV vaccine generic name. But I think there's going to be more than just Beyfortus available very soon. So we'll see. Either way, vaccine for infants going to be very much hyped and in the recommended formula for all healthcare providers here, coming, especially in the cold and flu season coming up. Winter is coming, don't forget. I'm looking at one thing real quick. So the recommendation from the ACIP is that this Beyfortus initially right now rolled out to children aged 8 to 19 months who are at an increased risk of severe RSV disease entering their second RSV season. So again, if your child or infant that would be indicated, if they are going into their second RSV season, which they would have been theoretically born towards the end of RSV season last year, going into this one, it's about the earliest cutoff time. So that's the unanimous ACIP recommendation. Hopefully it's a good step right now, preventing babies in their, first RSV season, from getting RSV. So anyways, what causes increased risk factors for infants for RSV? Does anybody know? Let's put it in the comments. What increases the risk factors for RSV? Anybody got that for me? So check this out. Premature babies. Most children have had RSV by the age of 2. It can cause severe infection in premature infants, babies younger than 12 months. So, babies younger than 12 months going into that season, as we saw, can be more high risk if they are immunocompromised, if they're premature. Again, it's one of the leading causes of lower respiratory tract infection. Again, high-risk infants, premature birth, bronchopulmonary dysplasia, congenital heart disease, neuromuscular impairment, immunodeficiency, and Down syndrome. So high-risk infants in those categories definitely have been identified to have more risk factors. Again, other host-related risk factors. Get this, host-related risk factors for RSV include young age below 6 months at the beginning of RSV season. So we're at the beginning of RSV season now. So 6-month-year-old infants now at the beginning of RSV season are at a higher risk. Multiple birth, low socioeconomic status and parental education, crowded living conditions, young siblings, maternal smoking, indoor smoke pollution, malnutrition for malnutrition for gestational age, family history of asthma, low cord serum, RSV antibody titers, and or living at altitude. Some of y'all live at altitude, Albuquerque people, Santa Fe people, Denver people. So again, RSV vaccine approved for adults over the age of 60 in May. And CDC officially put their blessing on it today. And it's going to roll out. Strongly recommended it for the ACIP recommendations there, as we listed. And that's cool. Fall and winter months, winter is coming. Vaccines should be taken care of. And that goes for flu and COVID as well. Anyways, moving on to the next segment, everybody. Thank you very much. Hope you're having a great Friday afternoon. Thanks for joining me on this Friday afternoon. Pharmacist Frontline, sponsored you by Pharmtrue. That was that. We're talking a little bit more about that CDC approval for the RSV vaccine. Cool. So moving on to Tech Talk, the next segment, guys. Is your health data secure? Let's explore solutions. Cool. So we talked about this the other day a little bit when we were kind of talking about GoodRx and how all that works. So kind of expanding upon the thoughts there, guys, in our Tech Talk today and health data, right? What does this even mean? Breaking down the systems and the actual problems that lead to like health data issues. So whether or not you're looking at health data reform, granted, lots of things by lots of people have been obviously, been identified for over like 30 years since HIPAA was designed. But anyways, check this out. Look at this word, de-identifies. So healthcare entities have had it written in on the HIPAA, verbiage here, that once a healthcare de-identifies health data or makes it to where the data cannot or should not be able to be attributed to a specific individual, HIPAA no longer applies. Interesting. Very cool. Got it. However, something strange about this is actually concerning. So, Dr. Bradley Molina, professor with the Vanderbilt Department of Biomedical Informatics and leader on privacy and the ethical, legal, and social implications of research, wrote this on data sharing and de-identification. De-identification effectively severs the relationship between individual patients and their data. This prevents patients from learning that data about them have been de-identified or shared, even if a breach occurs. Further, since de-identified data are no longer subject to HIPAA, there is no clear liability for a breach. Okay. So, what does that mean? De-identified data can be exchanged easily to non-health related people from health related people. So if health related people have been able to manage to de-identify data, and that's all right, but the thing is, apparently, this data sharing can literally take place with no accountability for the healthcare entity to ensure that the data have been sufficiently de-identified. So again, back in the day, like, the 1990s, there was no need for concern when this law, was initially put out, when this was a thing. But when you're looking at patients' health data, you can literally use digitally advanced, techniques. Programmers can re-identify health data with relative ease. So that's a thing. You can literally pass de-identified data, or entities can pass de-identified data about you, right? Which, no fun to acknowledge, but acknowledging it. So de-identified data can be passed about you, and then it can get re-identified by somebody else. Back in the day, that didn't used to be a thing. Now that's a thing. So again, what can be done about that? As creepy as that is, it's not going to prevent, the fact that what data may or may not already be out there, whatever that is. It's not a reason to encourage viewers or anybody to go get off the grid and stuff like this. It's just thinking about some of the accountability that needs to be written in, truly, at that point, because what can you do? What sort of regulations can you update for helping to, reconstruct the terms of de-identified data, which can be re-identified now? So HIPAA protections. Patients can currently request an overview of their health data disclosures, but once the data are de-identified, patients are no longer entitled to that information. So that's a shortcoming. I mean, you do not have a right to know where your de-identified data has went. Interesting. So clear standards should actually, be put in place, guys, right, to truly figure out this monitoring and regulation of de-identified data, prohibit data re-identification. Don't know if you can ever do things like that to that degree, but, to say things in that way, just so it could at least be talked about, it'd be worth acknowledging. And that's what I'm trying to do. So anyways, data infrastructure in healthcare, it's definitely not standardized. So that's interesting. And I would say most people are not even really fully aware of their rights. So again, there's no accountability when your HIPAA is, really disclosed. It feels like a bargaining chip to some degree with your provider. Oh man, you broke HIPAA. Therefore, do what I say. And that's not okay either. But people do have a right over their data. People do have a right to know if their data was shared, de-identified, re-identified, whatever all that is, really. But, it exists. So, AKA, hide your wife, hide your kids. I'm just kidding. Your data is not safe. But, most people can establish strategies to protect their own data. And we hope our healthcare providers and our health systems are doing the best that they can to continue to improve it. This isn't to trash on it entirely, just to make it aware that there are some gaps here, there are some limitations, and there are things that need to be considered, for sure. Cool? Capiche? All right, guys, moving on to our Enlightenment Hour. Turning on the light bulb. Cool. Talking about physical guidelines for older adults staying active and healthy. Very, very cool. New report from HHS, the Health and Human Services, has some new recommendations to improve physical activity levels for people ages 65 and older. So I'm going to go ahead and go over that with you guys. Adults ages 65 and older. What's up, Bullet Biter? I'll have to get you at the end. If you hang out, I'll put you in. Anyways, talking about again strategies to increase older adults' physical activities. New report recommends older adults 65 and older. And guys, I do have to remind you, next Wednesday, 11 a.m. at Amador Live here in town, there in downtown, we're doing a senior cannabis education special. So everybody is fully aware. We'll be hosting that through the Trichome Alliance, 11 a.m. Wednesday in downtown Las Cruces. We'll be doing senior education for cannabis. Very excited to, talk to everybody and get together and do all that fun stuff. So that's what I love to do. Anyways, tell your friends, tell your grandparents, seniors, hey, if you want to learn about what to tell your grandparents, what's applicable information, come check this thing out, right? Even if you're young. And, passing on good information does only good things. So again, next Wednesday in Las Cruces, downtown Amador Live, we are empowering seniors wellness, teaching and educating seniors on cannabis. But now I'm going over the new recommendations for older adults and their activity levels. Check this out. Older adults, at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity aerobic activities a week, preferably spread throughout the week. So what does that mean for you, grandma, grandpa? Again, can you do 150 minutes of moderate intensity workouts per week? That's 30 minutes a day for 5 days, or 75 minutes vigorous intensity per week. Much less, but vigorous intensity is harder when you are considering yourself a senior. And I'm saying adults over 65. Muscle strengthening activities. Adults over 65, it's time to get your Arnold Schwarzenegger on. Again, muscle strengthening activities highly encouraged. Moderate or greater intensity that involve all major muscle groups at least 2 days a week for grandma and grandpa, everybody. So tell them to get on the bench press. I'm just kidding, but muscle strengthening activities, okay? And again, talk to your doctor before you go and do anything that you may not be considering doing that you've never done before. It's not what I'm trying to endorse here. Last part of this here, multi-component physical activities. These include balance training to maintain strength and reduce risk of falls, such as Tai Chi, dancing, or water aerobics. So get in the pool. Cool. All right. Dancing, not a bad idea. Grandma, get up on that table, but be careful. Just kidding. So, collaboration in the community, I hope to encourage that within our senior community, older adults having other safe and accessible neighborhoods to be able to use, other devices, even if it's going to be wheelchairs, but things like even sidewalks, multi-use trails, walking, biking, giving that opportunity for older adults to collaborate and connect. Definitely always advocating, if you are an older adult, take advantage of the times where you can do that. This is, Las Cruces is a wonderful place to do that. Not everywhere is, but, Las Cruces is an awesome place to achieve all of your outdoor recreational needs. Right now it's a little hot for sure, but, other than that, guys, Move it or lose it. Geriatrics, we already know. Caregivers, we already know. Cool. All right, moving on to the Herbal Wellness Corner, brought to you guys by High Horse Cannabis Company. Got Carlos Condit tomorrow morning, New Mexico UFC legend, up out at High Horse on North Main, guys. So make sure you check that out. Very cool. Again, going over interesting topic here for everybody listening. So, I think for my viewers and for most people, you hear many things about the data, like how can cannabis help with treating the symptoms of opiate withdrawal? How can cannabis help in the interventions and the therapy when it comes to opiate reduction? What does it even do, right? So when it comes to opiate withdrawal, cannabis actually helps with, nausea, vomiting, diarrhea, cramping, muscle spasm, anxiety, agitation, restlessness, insomnia, runny nose, and sweating. Right? So interesting, right? So a lot of those opiate withdrawal symptoms right there, they call it kicking. When you're having that, sweating and agitation and restlessness and spasm, people have to kick and sweat that out for days. Cannabis can help with that when it comes to opiate withdrawal. Pretty cool, right? So cannabis, the data is promising. I can go over multiple studies and, right now is not necessarily the time I'm going to do that. What I'm going to do is talk to you guys and give you guys like a little guide about what actually happens and how to use cannabis to reduce and replace opiate drugs. Right? So this is actually like, clinically with what limited data that we have, this is how it's being done. Okay. So you guys check this out. Starting with as little as 1 milligram of THC below that 2.5 milligram psychoactive threshold, small oral doses of cannabis with every oral dose of opiates to start and replace that. Again, talking about how to use cannabis to reduce and replace opiate drugs. Guys, the war with opiates is something that the cannabis industry highly aligns with. The data and the evidence for how to make it perfectly happen is not necessarily, 100% there to support it yet. But this is what's being done now. So again, starting, with the cookbook here, how to replace opiate drugs with cannabis, how to reduce and replace. Okay, starting with as little as 1 milligram THC with your opiate dose, you will introduce cannabis here. Psychoactive threshold, 2.5 milligrams of THC. Again, always use the lowest effective dose of cannabis. Avoid building a tolerance. So what happens after that? You have that kind of like obviously scripted dose there. And then your breakthrough, that's where inhaled cannabis is used. So inhaled cannabis is used for breakthrough severe pain, breakthrough flashbacks, breakthrough panic attacks, breakthrough withdrawal symptoms to reduce craving. So again, yes, for most people right now, it's probably going to be smoking it. There's not a lot of access to inhalers, but inhaled cannabis, the best type of smoking it would be actually using vaporizers such as like the Volcano vaporizer. And this isn't like vape pens. It's like an actual vaporizer. It vaporizes flower. Using that for breakthrough symptoms, severe pain, flashbacks, panic attacks, withdrawal symptoms, etc., to reduce cravings. Interesting. So initially you're taking cannabis with opiates, trying to get off the opiate dose. You pair, an oral dose of cannabis with your opiate. And then if you actually, instead of using a breakthrough opiate, you're going to start trying to introduce inhaled cannabis. And then from there, you're using cannabis to help enhance essential health promoting non-pharmacologic activities such as savoring, exercise, meditation and prayer, journaling and reflecting, cognitive and behavioral therapies, sleep patterns. However, sedating strains would promote more sleep patterns more regularly than non-sedating strains, and that can actually be a thing. Again, combinations of CBD and THC 1-to-1 is very, very broadly effective here. So some people prefer CBD in the day, THC in the night when it's, using this to treat opiates. However, that 1-to-1 ratio is a very broad, nice use there. So again, if you could somehow introduce that 1-to-1, oral THC with your oral opiate dose and then inhaled THC for your breakthrough, it's a great idea. Cannabis naive people using this protocol can reduce opiate dose by 50 to 80%. Super cool, right? Experienced cannabis users have to do a different desensitization to cannabis before using it to help start the opiate taper. So if you've been using both cannabis and opiates, you have to actually desensitize to cannabis 6 days before starting the opiate taper, so that you can make sure that you regulate your cannabis tolerance building as your opiate tolerance, starts to wean. Again, starting low and going slow for sure is the recommendation in all these cases, but doses as high as 500 milligrams 3 times a day of CBD and THC can be considered for the helping in the opiate epidemic here. Pretty cool stuff, guys. I hope everybody's enjoying the information. Got a question here. Julie Tobin, is RSV bacteria or a virus? So, as the name says, respiratory syncytial virus. Again, common respiratory virus, causes usually mild cold-like symptoms. Just wanted to answer that question. Thank you, Ms. Tobin. So, interesting and promising way to address these steps for how to educate someone on how to wean themselves off of opiates using cannabis. The methodology is still going to continue to improve, and I'm very optimistic about that. Talking about the Herbal Wellness Corner, sponsored, guys, by High Horse Cannabis Company. Go and see him tomorrow to go see a celebrity bud tender, Carlos Condit, owner of Oddfellow Cannabis, and he's selling his cannabis strains over there at High Horse on North Main tomorrow from 9 to 1. Very, very cool. Anyways, moving on. Next segment of the show, guys. Happy Friday. I hope everybody's having a wonderful, wonderful afternoon. Everybody's getting prepped up to have a wonderful weekend. Got a shout out here, community shout out. I'm going to go ahead and share this to my Facebook, YouTube, Twitch, Twitter, Instagram stream. Sorry, Instagram stream, you guys are not going to get it. But a community spotlight for Anthony, a little 5-year-old, adorable young man. So Anthony, check this out. He is a newly inspired race car and specifically dirt car driving race fan. found here in the number 34 legend. I believe that is of Stephen Mathy, where I'm sharing the picture, race driver at Vado Speedway Park. He was able to take he got some hero cards from the drivers, and the hero cards is like a picture of the race car, of the driver's car, and he cut it out, and for his school project this week, put this on a teddy bear for those of you who can see that on that stream. So he came back and he had a school project, and he was supposed to fill up this little teddy bear with the things that he loved the most. And he sent back, a little teddy bear with these little race cars in there. Very, very adorable. And that was his first time ever, little 5-year-old up at the dirt track races over at Vado Speedway Park. So again, in our community spotlight, sponsored by the Trichome Alliance, promoting the butt cancer research case study, recruiting 42 local cancer patients here in the Las Cruces, New Mexico region to introduce or try using full spectrum cannabis oil as a, possible substitute or, an intervention for cancer pain medications, cancer nausea medications, quality of life indications, and cancer research study, among other things, guys. So if you guys want to pioneer the new industry, if you guys want to challenge opiates against cannabis, sign up, have somebody that you know or love with cancer sign up for the butt cancer case study. Go check it out at trichomealliance.org/buttcancer. Very, very cool. But yeah, so that's the shout out for our community spotlight, sponsored again by the Trichome Alliance. And we are moving on to the last segment of the show, guys. It's been a fun and fast Friday so far. I hope everybody's gearing up to have a great weekend. I sure am. And I'm going to fix all that. So I'm moving on to the next part of the segment. Men's Health Minute. Man, I'm just going to pump you guys with facts right now, and women, so you can pump your men with the facts. Again, summer driving safety, guys. It's Friday night. Talking about summer driving safety, travel plans, happening on Friday, hottest topics of the summer, whether you're meeting your family at, family houses, taking other types of various road trips, planning trips, driving on a wide open highway, sometimes feels like the nice, fun thing. However, sometimes poor planning, bad driving conditions, traffic, and other drivers can shatter these visions and lead to, dangerous driving conditions. So again, guys, knowing the risks of, car accidents may actually help avoid traffic accidents, improving your driving habits and awareness. Again, almost 80% of crashes involve some form of distracted driving. What counts as distracted driving? Texting or talking on the phone while driving, eating and drinking, talking to other passengers, using vehicle or handheld technology, reading a map. Being thrown from a car during a crash is almost deadly. Always. Seatbelts save lives, so buckle up. Everyone over the age of 5. Again, aggressive drivers, men. I think this is one of my big take-home points. Swallow your pride. Men's Health Minute. Aggressive driving. Avoid tired driving this summer. Avoid aggressive driving. Avoiding distracted driving. That's what I got for you guys. Be safe on the road. Have a fun weekend. It's Dr. Joaquin signing out.